later, if they're not here yet, will be the business development head of our commercial group, Carla Sonar, and the business head group also for our residential projects, Ms. Ana De Lara. I don't know who else is on board already, but I'm happy to have no less than our own managing director and owner actually of our companies, si Ms. Chari Yulonang. Chari, where are you? I cannot see, but I saw your name coming. So, okay, that's as far as Carmen Ray is concerned. The other guys that are on board right now is Philinvest Technology Park. I don't know who is representing Philinvest here. First Philippine Industrial Park, this is the Lopez Park, owned by the Lopez, being represented by VP June Lizardo. Gateway Business Park, this is the park of Jean de los Reyes. Iho Industrial Estates, based in Davao, new entry, owned by the Tuasons. Yeah, I mentioned already. Si Lowy, I don't know if Lowy is here or Matillana, wala pa, no?
Wala pa yata.
Then, Laguna International Industrial Park, LIIP, one of the pioneers also. This is the group of Sina Elena Lim, no? Technopark, Laguna Technopark, owned by the Ayalas, to be represented by Ms. Rona Sañez. Limaland, also bought recently by Aboitis. I haven't seen Clifford Academia yet. Okay, I just saw June Lizardo there of FPIP. Science,
right, yes.
Okay, Science Park of the Philippines, ICCP group. Actually, they have 6 parks being represented here today. And then we have SunTrust Ecotown, Mega World Group, to be represented by GM attorney Basil Almazan. Finally, Teco Industrial Park. This is a consortium of various corporations. Today going to be represented by Toti Reyes, he's the vice chairman. Okay.
Okay. Is that the one in Subic?
Hindi. Saan ba itong si ano? Teco Park. So anyway, 1,172 locators today.
Okay.
Spread across 22 ecozones. No? This represents about 46% of the total pie. In exports alone, we accounted for $361 billion. This is a 2018 figure. Noong 2019, medyo bumaba for several reasons. The biggest one being the Sitira, thing looming over our heads. No?
Of course.
Employees, the employee number stands at 325,000 or 65% of Ecozone workers. All right. Interesting to note, Jopin and guys from the Project ARK group. As of today, all right, and I tried validating this figure, we've had a total of, reported 2 weeks ago, a total of 2 cases within the ecozones. Yung isa that was supposed to be validated, false alarm pala, he was not. No? So the one that's confirmed that we have is security guard pa. So technically, parang supplier yun. All right, so as early kasi as January of this year, a lot of our locators, being multinationals, kept their ears to the ground about this brewing pandemic. So they were very, very conscious about this thing eventually hitting our shores. So a lot of them that early were already implementing very, very strict protocols like, mandatory face mask, temperature checks. Before you enter the premises, you have to fill out a travel history form, of course, the alcohol sprays. And then at that time, it was called physical distancing during meetings. I attended 2 of these meetings and I experienced it. Hindi pa social distancing ang tawag na. So these measures that early seem to have worked. No? Kasi, my goodness, with a population of that much and you only have 2, yung isa hindi pa pala totoo. No? We must have been doing something right. So the challenge of this group right now is how to get back to normal as quickly as we can, because as you know, every day that goes, we lose money. Everybody loses money.
Yes.
So in fact, lately, we are appealing to IATF to reconsider this Laguna classification. Ano pa rin siya, ECQ pa rin. No? Anyway, that's another story. But because a lot of our locators are really wondering why Laguna, despite our track record. So what we are here to do is to seek the best option for testing. Testing system that is reliable, rapid, and reasonably priced. All right, and one that will be administered systematically. So we're here to listen to what you guys have.
Okay, excellent. So we do consider the industry. We consider you, of course, your locators are all industrial or mostly industrial, part of the industrial sector. So we consider this a very, very important segment, much as we are considering the MSMEs, which Go Negosyo has been shepherding for the last 15 years, also very important. Sa inyo kasi mas madali kaysa sa MSME in the sense na you're like this, no? With one call, you are able to gather 50 people in one room because you are all moving in one direction and you want to be safe and you want to return to work very quickly. Correct me if I'm wrong, but a certain percentage of your locators and the employees of your locators are still working, right? Even during the lockdown?
Yes, that's correct. Pero at best, I think on the average, siguro we're looking at 60% modality. Kasi nga, the biggest problem right now, aside from the restrictions, is being able to transport, effectively transport the employees. What a lot of our locators have done is they've attempted to house within the factories their workers. But that, as you can imagine, can only go so much. Plus the fact that ang hirap i-transport walang transport. So right now we're looking, at least in our parks, we are going to try and figure out a way of commissioning theories, but giving them exclusivity over certain locators. So it becomes safer and guaranteed mobility for the employees.
Okay, right. So I asked that because among the first questions and the first questions of the companies that urgently needed testing options when we first introduced ARK in the third week of April is how do we make sure that the workers that we are housing in our various facilities, in our factories, are COVID-free? And then how can we usher in the new set of employees that will be coming back to work? So we totally understand where you're coming from. Well, good. So even before we start our presentation, yes.
Yeah, sorry, I just saw my president, Mr. Joser Santos, walk in, so he's
yes,
with
please,
us.
let's acknowledge. All right. Which is perfect actually, because I'd like before George and I make the presentation about ARK, Joey is here already. He just finished his interviews, and it would be best for us to start our meeting with him talking about how all of this started anyway and where we're going. It was his idea even as early as March when the lockdown started. He has been gathering the business leaders and business groups around the country to talk about preparing for when we can restart the economy as soon as possible. Obviously, pa-delay yon, but now we have more news, and I think Joey can give us more. Can give us ideas on how those things are, Joey. So our presidential advisor for entrepreneurship and founder of Go Negosyo, which is implementing this project ARK. Please welcome Joey Concepcion.
Chopin, where am I again?
No, this is the group of the Philippine Ecozone owners around the country. Chito Zaldariaga just gave us a little bit of a background, but essentially, this group represents 1,000 plus
Almost
locators. Yeah, 1,000. And in terms of contribution to the economy, it's about 46% of the economy that the production happens in all of these locations. That's how important this sector is.
Okay, so anyway, we're NCR and Laguna are still in a modified ECQ, and I think that's at least some progress, no, or maybe a lot of progress. I got from Secretary Galvez the details of how they define all of these queues, no, and
Joey, if I may interrupt, just before you came in, Joey, Chito was saying that many of these people are actually pioneers, and they made Calabarzon what it is now. So one of the things that they're scratching their heads about is how come Laguna is still on ECQ.
Yeah.
Yes.
In fact, Joey, sinulatan ko na si Nograles earlier, citing stats that I wonder if they really looked at that long and hard. But we ourselves were wondering why Laguna is still under ECQ, no?
Yeah, I know.
Earlier, Joey, before you walked in, I was giving some stats on the incidence of contamination in parks. A total of 2. All right, a total among all our locators, no? A total of 2. And yung isa, ano pa pala, false alarm, no? Because early on, kasi we've been doing very strict.
Yeah, as early as January. Yeah, as early as January, this group has already taken safety measures. I'm going to go on audio, no, just to preserve bandwidth. Siguro po yung iba who can preserve bandwidth also can do that. Sige, please, Joey. Sorry for interrupting.
Sorry.
Please go ahead, Joey. Uh-oh. Did he also disappear? Joey, are you still there? I think we're having technical problem. Hindi, eto na. Yeah, nag-video lang, nag-audio lang siya. Joey, are you there? Hello? Joey? So I wanted to make sure that he had the background of what you needed to hear and what direction you're also going. Tingnan natin. Sam, paki-check kung nagre-reconnect si Joey. Sige. So, but welcome, no, to especially the newcomers. Wow, we're already 55 now.
Am I back?
Joey? Okay, good.
Yeah,
now we can hear you.
Yeah, something wrong with my signal. Anyway, so so I mean, you were saying that why is Laguna part of this whole ECQ? I guess I think it's still appealable, but I think the deadline for appealing should have mayor, no? I mean, they must have a reason why. Hello?
Yes, we can hear you.
No, are those cases just 2 or 3 in Laguna? I mean, Jopin?
In the Ecozones, in the total Ecozones in Laguna, there's just 2.
No. But you can't look at it that way. They have to look at it in the entire area. No, not in. Doesn't mean that just the Ecozones, but the barangays around Laguna. But anyway, but from what I saw, many things are already open. No, many things are already open. I think. Did you get that list, Jopin? We can share it with this group. No, the details of that.
Okay.
So anyway, regardless, whatever transition we're moving towards the GCQ will, I'm with this setup. The only problem is transportation is still not allowed. No, that's still a problem. But from what I saw, almost all construction is allowed, and many other things. No, on the export side and all of that. So we have another couple of weeks to, or maybe more than 2 weeks, but I'm confident that we will definitely move towards the GCQ. And that's why Project ARK was envisioned. And in my interview just a while ago, I was explaining the importance of our role in the private sector and why we have to really test. No? Because it's really a choice between lockdown and testing. Lockdown is a form of isolation. 14 days, we've done basically 4 of that already. That's a lot. When we reach May 15, we're approximating already what Wuhan had, no? Which was 78 days. No? So we're there. We're about 70 plus days by then. So if you look at the scale, what happened in Wuhan, China versus us, definitely we didn't have that huge number of cases. No? But then again, you can say maybe the discipline of the Chinese is more stringent, no, than us. No? But nevertheless, I think we have to move forward. It's an improvement to the ECQ of the past. Now, how do we move beyond? And the strategy really is let's just forget about a cure on the virus. No, I mean, if it comes, it comes. No, so that's the bonus. Let's just pray that it comes. No, but the way that we're planning this is we plan on the basis that how do you coexist with the virus? No, assuming it's there for some time. So once we are able to contain the infection level, then of course the quarantine measures will go down. And I just didn't bring my chart, but you will see it clearly there that there's a lot of yellow, which means that's already GCQ, and there's a couple of green. No? So that's a good sign that it's just NCR and Laguna. Now, what we have to do as a country, and even an NCR, which bulk of the GDP comes from NCR and the Calabar area, we really have to be guarded, no? And there's no other way to do it but to test. And so there's testing, isolating, and tracing. So the isolating, we can contribute there as our employees get, if they're determined to have the infection, then we have to isolate them, and we can trace already from that point. But testing is imperative. And it's not just a one-time thing. I know we have about 400,000 test kits coming in this Sunday, and that will be the start of many other companies going to test, and there are more people ordering. But the challenge is continuity, no? So testing is not a one-time thing. It has to be continuous. It has to be done and studied depending on your risk profile. So if we're using the rapid test, like our company, we're going to do it twice a month, no? On the first week and the third week. To me, that's the ideal, because with the rapid test kit, you definitely will catch it on the 7th, 8th from the time of the person gets infected. So you really don't know when that person gets infected, no? I mean, some of them are asymptomatic. So you try. So that's why the first week and the third week are the most ideal times to test them, every 14 days. Similar to how Ricky Razon does it, no? And I think that's proven to be a good method. Now, if you can't afford it to do it continuously, then you can taper it off after the first 2 months, no? Just to be able to get a benchmark. Now, what the group has done, ARK, is to also support the government hospitals with PCR machines, no? Not only PCR machines, but automatic extraction machines. Those two are very important. So former Secretary of Health Janet Garin is a private sector implementer there, and she is good at doing that. She's former health secretary, and she's fantastic. I don't think ARK would be able to do all of this in what I'd say 2 weeks' time, from the time we thought of raising the money and from the time of ordering, and we're paying already everything today, and it's being shipped out, I think, this week on a C-130, which the government is providing. So then we ship it to the 6 hospitals. Then we are looking at a combined capacity increase of 7,000 swab tests on a daily basis. No? So that's the goal. That's the first group of 6 hospitals. And we are gradually receiving more donations for this. No? Why do I say PCR is important? No? PCR is important because under the DOH protocols, all those confirmed to have infection should be tested with a swab test. Now, under today's conditions, asymptomatic people will not be able to fall in line, no? Because there's no capacity. But later on, when there's capacity, yes. But eventually, there are some people who prefer to do PCR testing now. Now, at this level of 3,500 versus rapid tests of about 450, not many companies can afford that. No, just at the number of 1 million test kits and at a price of 450, that's the lowest price that bulk of the people have ordered. But there are many who have bought at the 600, 800. That alone is already 500 million pesos of test kits that are arriving, being paid by the private sector. So imagine if you're going to pay 3,500 for a PCR, you're talking of billions, 3 billion plus 4 billion pesos. And that's going to be really a big burden on the part of many, even big establishments that we can't afford. That's why there is no way, but we will really have to use the rapid tests as a screening process and use the confirmed people in the rapid tests for the PCR. So that's the strategy. How long? To me, how long? That should be our strategy indefinitely till we find a cure for the virus. And that's the only way that the government will allow us to continue opening up the economy, put it bluntly, because as you open up more the economy, the risk definitely goes higher. And if you look at the cases right now, Wuhan is now going to test 11 million citizens, no, in what if I'm not mistaken, 10 days. Shucks, that's a huge capacity of testing ability, no. So, but China can do it because Sansure comes from China, so they have that kind of capacity there, no. And the Philippines, what are we targeting? 30,000 a day on swab testing. Of course, in rapid tests, we just bring up the test kits. We can do anywhere between 30,000 to 50,000. So these 1 million test kits that are arriving in the next couple of weeks, that's about 30,000 a day. But then that's it. For that may last us only for a month and a half. But this strategy can't be only for a month and a half. You have to really think of this really long term, or else we open up ourselves to potential risk of another second wave and another lockdown, which this will be really devastating to our country. No,
Yeah.
So that's it. That's it, basically.
Okay.
Yep.
All right. Thank you, Joey. Yeah. So Joey, as much as you can stay, I know you have other appointments, but to the group, if you have questions before Joey needs to go, can you may want to raise them now before we even start the presentation.
Well, Joey, this is Chito Saldariaga.
Hi,
thank you for joining us. Thank you for joining us. I joined one of your previous meetings, and I said of all the programs that I've seen, this is probably the one that has the most science into it. Couple of questions. There's first the capacity. 1 million doesn't seem enough given how many people we have here. That's one. Capacity and therefore ability to be able to supply. Number two is the reliability of the rapid testing. I mean, there have been rumors that it's not that reliable. There's like a 40% chance that it could still not be as accurate as it should. In which case, are we just blowing in the wind and then waiting for the swab test to come on later? Or can you put that in perspective?
Let's put it this way. I've used it on myself. I used it on family. I used it on a lot of infected people. My own family doctor, whose father passed away, he was waiting for his swab test result. He died. He didn't get the result, but he knew that he was infected since I lent him a rapid test. Both father and son and mother were infected. The son was already IgG positive, IgM negative, which means he could have infected his own mom and dad. Had he taken the test earlier, maybe he would have not exposed himself to his mom and dad. So this is an instance. I've got a friend who owns one of the biggest meat companies. His entire family suspected they have, but they didn't feel like they had the virus. But it lasted for about 3 days. So I gave them the rapid test. They all confirmed to be IgG positive, which means that they had the virus and they just didn't feel it and they were positive. So they went for a swab test to reconfirm that, and the swab test didn't match. The swab test still said that they had the virus, which was basically IgG and IgM, so which meant that the swab detected so it came out. So they retook again to be IgG, IgM, which means that there are remnants of the virus there, which the PCR cannot determine that. So there are advantages, and as I said, the inaccuracy comes when you take it too early. So let's say you get infected on the day one. It's very hard to say what is day one. Mingita, I don't know if she's here, can explain that better. But so day one, you won't find that. That's where the PCR can detect it. Day one, day two, that's more accurate. That's the advantage of the PCR. But then you don't go to the hospital to take a swab test, no, because again, they're not going to, unless you're symptomatic, they're going to hold back, no. And with today's there's no capacity, definitely you're way last in the line. So right now they don't test any asymptomatic people, no. So it's basically, that's why the Razon model works best. You test in the first week and you test in the third week. So my own experience here with Manila, and now recently with Antipolo, we just had a press con with Mayor Henares, and clearly they are on GCQ and they deserve to be GCQ because they only have 0.2%. Basically, I would say 3 people out of 1,500 or 600 people. No? So you can see that it matches. No? Now, again, there may be false positive, they may be false negative, but what option do we have right now? Unfortunately, there's no visibility. Number 2, assuming we have now the capacity of the swab testing with what we're trying to do with government, we suggested to these hospitals to target a price of 1,700. That's in the agreement. And hopefully they will comply with that agreement. And then it becomes more affordable. But if it's at 3,500 at Red Cross and the other hospitals are at 8,000 bucks, who can afford that? And by the way, how many times are you going to do a swab test in a month? You can't do it also once, because anybody who goes out of house, like my house help, they will be not allowed to come in anymore. They'll have to stay out for 14 days and take a test, whether it's a rapid or a PCR. Rapid will be easier for me because I can test them 5 times as much as I want because it's cheap. So along that process, I'll be able to capture it. So to me, frequency is more important than doing a one swab test once a month. The guy goes out, rides the bus, sits down beside an infected person. The next day he's already infected. So it doesn't work that way. So everybody has to develop your own testing strategy. If you're going to confine your people in the plant, which we do, then we will test them only once a month. But if they're going to go home on a daily basis, we can't do that. We'll have to test them twice a month. So you determine which is cheaper. House them in the plant and let them stay there for months, or let them go home every day. And if you just run the math, then that's fine. But in the end, many companies are not going to do swab testing very often. It's very inconvenient. The risk is also high and expensive. Even at 1.7, that's also expensive because if you have to do it twice a month, that's 3,600 there already, no? Thereabouts. No?
Okay. Thank you, Joey. And to add to that, Chito and everyone else, we've made sure at ARK that we have access to really good test kits. Our medical panel is validating the test kits even before we endorse them to anybody. So lately, I think at the time that you joined that meeting, Chito, we did not yet have a supplier for an American brand test kit, which has a 99.6 specificity, meaning there's a margin of error of 0.4 and sensitivity of 96.4. So, I mean, as time goes by, while there are no perfect tests, whether this is PCR, antigen, or rapid test kit that you're looking for, the technology is getting better and we are getting more accurate test kits. And later, Joey will make sure that they see the chart where we can show when to take the PCR and when to take the rapid test kits so that they'll be properly guided.
Let me add to that. No, okay. We have 2 brands, no, that we retested on patients who have COVID, no, just to be sure that we're on the right track with these 2 brands. But the brand that we're bringing is Innovita. So, but I decided to test 2 other brands, no, that we're looking at. One brand, so these were 5 patients confirmed to have COVID. So when you test them, they have to be all IgM positive, no, or IgG and IgM. One brand was a perfect score of 5. One brand was just missed it by 1, so 4 out of 5. So it's not bad. I mean, it's better than, not knowing what you have out there. That's what I'm trying to say. So even if you have, if you did a PCR, the swab test, and out of 100, you had 20 confirmed. But even if, let's say, the rapid confirmed only 10, by God, that's already a lot, because that 10 will infect as many people as a 20 would. But what I'm trying to say is, rather than just use a mere temperature, even just one person can infect the entire production facility very, very fast. So that's what we're trying to go after. Just do a screening. And it's the best thing that we have at this point in time. If we had something that is really super reliable, maybe like a PCR that is rapid, then great. If the Abbott machine does come to Manila, but that's going to be so expensive. The test kit of that Abbott, I'm sure it's not going to be cheaper than what we are using right now. No, but again, that Abbott machine that's on a PCR base, which is rapid based, we're, according to Babes Romualdez, we're in the middle of the entire world that is the next in priority. So that's still a long way to go. And the priority for those Abbott test kits, which are rapid PCR test kits, are going to be for the airports first. No? That's the more important place. Those test kits, those machines should go first. Okay.
All right.
Thanks.
So,
Thank you, everyone.
all right. Thank you, Joey.
Thank you,
So-
Joey, for joining us.
Thank you.
Okay.
Thank you.
Okay. All right, great. So now I think we can get on with our presentation. We'll between George and I, Chito and everybody, we'll try to make it short so that we can welcome more of your questions.
Sige.
So Sam, can we put
and please, okay, Jopi, and please,
Yes.
as much as possible, do the presentation in English, because we're not doctors or medical experts.
Of course, we are not
neither
doctors
are
also.
we.
Sige.
Neither are we. And we will
Okay,
not
okay.
pretend to speak like doctors, okay?
Sige, sige,
Yes.
sige.
All right, great. So I'd just like to summarize what Joey was shared with you today. So ARK as it stands, I'll just assume that only Chito was able to hear about ARK during that presentation for the industrial group. So we've made this poster to simplify the three basic pillars on which ARK stands, and these are: one, antibody rapid test kits; two, PCR testing, which is the swab testing that Joey was mentioning; and three is a data collection of all of the test subjects that will go through the testing. So one, let's go to the antibody rapid test kits. So why antibody rapid test kits? We already know the limited capacity in the country. We already know that those returning to work, if you do not have any symptoms and you are not severely or critically ill, you will not be eligible for PCR testing in the limited capacity of the country. So, which means if you want to test, if you want to find out where this invisible enemy is, what is your alternative? So we found these antibody rapid test kits. So we've said that the communities around us and the communities of our workforce, of our working community, can use this as an option, and it finally makes screening accessible to them. It is also more affordable than PCR testing, and with the right planning, it can be done in a recurring manner in your workplace. Second, the second pillar is the PCR or swab testing that Joey mentioned. So before I say that, let me just reiterate, all of the things that we are doing here in ARK is voluntary. The decision of a company to buy rapid test kits or go through PCR testing is their own decision. And as of now, it is also our own budget. For those asking if government will ever give a subsidy to this, we don't know. But as of now, even seeing the return to work guidelines that DOH is set to release anytime soon, we know that if we want to do testing to make it to find out if we can, secure the health safety of our employees, it's really up to us. Sariling sikap po ito. So antibody rapid test kits, the 1 million that mentioned by Joey, that's 1 million already purchased by private companies. And that is just initial orders. What we did was in ARK to find suppliers who can continuously supply hundreds of thousands of these test kits moving forward, so that when the companies have finally done their test plans within their own companies and they need more of these test kits, they will not run out. In the beginning, in April, when we introduced ARK, there was really a shortage of test kits. We were competing globally with 90 countries experiencing COVID. And at the time, in the third week of April, only 2 brands were available in the Philippines. Now we have more. Now people are seeing, our countries are seeing, China, US, Canada, Korea, and Germany are seeing that we are serious, at least the private sector is serious about screening our people. So they are now starting to make available really good test kits. Okay, so number 2, PCR testing. Joey mentioned that we as a group are donating to 6 hospitals around the country complete and automated PCR setups. We had the MOA signing last Saturday and identified 4 hospitals in Metro Manila, 1 in Cebu, and 1 in Zamboanga, to add something like 7,000 daily testing capacity for PCR testing to the national count. So this is our contribution to the national goal of having 30,000 PCR testing capacity per day. Now, why are we doing that? You know, from antibody rapid testing, if you find that you need confirmatory test, or if you find that your worker has COVID and you need to have this double checked with the PCR testing, right now, hindi po pwede yon. He will not be allowed by DOH to take that test. Why? Because there are more needy people that have to fall in line. Now, Red Cross already has additional capacity, but again, that's prioritized for severely ill and critically ill people. Now, with this donation that we are giving to 4 hospitals in Metro Manila, 1, we deliberately chose to be near the Calabar zone, is the Perpetual Help Dalta in Las Piñas, so that it is as accessible as possible to the Cavite, Laguna, Batangas area. It's a private hospital, but for all 6 hospitals that we've donated to, we put it in the agreement that they need to charge 1,700 pesos only, or up to 1,850. That's the maximum for a private hospital, instead of the 3,500 cost at Red Cross, or the up to 8,100 cost for a PCR test in a private hospital currently. So not only are we adding capacity to the national count, we are also driving the price down. And if this initiative is successful, we will get government to recompute their cost so that more people will be covered by PhilHealth when for PCR testing. So that's the second pillar. And the third pillar of ARK is data. Test data. You get tested with an antibody rapid test kit or a PCR test. Doesn't matter, as long as you get tested. The only thing we ask for all of this information and protocol that we are sharing with you, in exchange, we ask you to share data with us that we can pass on to DOH, to IATF, to DOST, so that in their data warehousing, in their data analytics, they can provide us a clearer picture of the real extent of COVID-19 infections in the country. Okay, so next slide, please. So for the next part of this presentation, I will ask George to tell you about it. George Royeca is the founder of Angkas. He is a business person with 30,000 riders dependent upon his organization to keep them safe. So from his perspective, he will tell us why it's important to do Project ARK. George?
Thanks, Jopin. And also, I think the information that Jopin is trying to say is not just related to rapid testing, but also for the RT-PCR. I mean, as Ecozones, you guys have the capability, and I know some of the Ecozones already have labs in them that have PCR machines, and that's something that you use it for fruits or whatnot. That's something that we could probably also share information with you, with of course former Secretary and Congresswoman Janet Garin. Anyway, moving forward, right? The ultimate objective of Project R is really how do we restart the economy while we ensure that our people are safe amidst the time of COVID. We have to understand that you only beat the COVID virus until you have a vaccine. And that can take months, if not years. What do we do before then? We cannot sustain a prolonged lockdown with zero economic or very little economic activity till that happens. What we need to do is find a way to live with the virus. And we can do that. We can live with the virus, we can manage its spread, and we can prevent future outbreaks until this vaccine is found. The government is looking at three things. That's test, trace, and treat. For Project ARK, we have three T's also, which is test, test, test. And we believe visibility is really important. Why is visibility important? Because testing is the only way, as what Joey has said, as what Jopin has been saying over and over again also, this is the only way we can see our enemy. We need to identify those who are infected, isolate them as quickly as possible so that they don't further infect the general population. And we need to treat them immediately so that we can make sure that we have enough hospital beds to accommodate all the sick. Now, as you know, what Jopin was saying earlier in terms of the three-step process, the first step is really just filtering, right? You're really screening your workforce. And with rapid tests, you can screen them in a scalable and cost-effective manner so that you don't have to test everybody using RT-PCR. We have an algorithm later that will be explained so that you mitigate also the against the potential inaccuracy or the potential false negatives and false positives that you could potentially get for rapid tests. And this is in the algorithm that we have within asymptomatic and symptomatic patients. And what do you do with it, right? In order to make this happen, this flow, of making sure that we don't overwhelm our medical system and guaranteeing that all 20% of COVID cases that need to be hospitalized are given adequate medical treatment, we need to test as many people as possible. And this is to Joey's point, right? The problem is 80% of all COVID cases are either asymptomatic or mildly symptomatic. That means many of them will never feel the need to go to the hospital, or they will be at work and you'll never know that they have the virus and spreading it. And those that show very mild symptoms that do decide to go to the hospital will not be tested because of the current hospital protocols, right? This is where the private sector, becomes very crucial to helping the government stop the spread of this pandemic. This is the commitment of ARK, is to get the private sector to commit to regularly screen. We don't have any membership fees. We don't have, any monetary benefit here, rather than, really advocating to get more volunteers to come in. So with Ecozones, right now with Project ARK, we actually asked the private sector to adopt the barangay. But essentially your Ecozones, some of you are big enough to actually have your own community there. You actually act as your own barangay already. And basically this is a tandem. No? This is a two-step approach in testing. So private tech companies continue test kits at the LGUs to test the communities in the barangays where the employees live, and be able to add a second filter when these same people go to the workplace, you have them tested again the second time around. So this is where you, the business owners, can really enforce your own rank. So that's very, very critical to have that tandem. No? So I always talk about this when I illustrate, to illustrate my point. Imagine two restaurants. Restaurant A on the left and restaurant B on the right. Restaurant A has this big sign saying that, we disinfect on a regular basis. We do massive testing to our employees on a regular basis. We follow all social distancing protocols, versus the restaurant on the right that does none of those. Of course, the obvious answer is you'll be more comfortable, getting food from restaurant A, but see, this is what we need to kind of push out into the market, because even if the lockdown is lifted tomorrow, you have two problems. Your first problem is, your workforce will still be afraid to go to work, essentially, because who knows, right? What's going to happen? Yeah, they're going to be afraid that they get infected going to work, using the public transportation, and when they get to work. So that means that we need to have some visibility at the workplace. So this is why we put in this filter, or this screening process, or mass screening process. The second is really consumer confidence, right? So when you don't apply these safeguards, then you don't signal to the consumers that you're taking the necessary steps to be able to conduct your business in a COVID-free environment. So basically, we're using all of the tools this in our disposal currently with the technology that we have, which is the rapid test and the RT-PCR, and putting it alongside clinical diagnosis in physicians to be able to analyze this data properly, right? And all we ask is you follow the medical protocols which Dr. Mingita, together with our medical panels, created. One of those protocols is very important, that you commit to test your workforce regularly. Like what Jopin said, you can purchase the kits anywhere as long as they're FDA approved, and preferably one of the kits that our medical panel of infectious disease experts has validated. But you can also get it from the ARK, which we've already negotiated. Jopin has done a fantastic job negotiating pricing there and also supply. And some of the people that is actually supplying the ARK aren't making any money as well. They're doing this for the country. And the last one is really to consolidate this data. So our data the data that you give us, the data that we have from the barangays and the LGUs, and the data from the private sector will be consolidated and sent to a company called Thinking Machines. And this company is the one doing the data warehousing of the OH. And this data, together with data from the public hospital, from the private hospital, from the LGUs, from the OFWs, from the national government, and now from ARK, from the private sector and the LGUs that we do barangay testing, will be consolidated so that we can put it together and visually map the infection rate in our communities. This will enable us to analyze the data more effectively. Next slide, please. So this is the basic simplified version of mapping, right? So we wish to map all 1,710 barangays of NCR in the beginning. And so we started talking to the LGUs, but now it's expanded to Region 4A, of course, which is the Calabarzon area, and now we're going as far as Batangas and also Davao as well. So we're really expanding to see how these protocols can be used pretty much everywhere in the country. So the idea is right now you have these gradients. There's three, safe zone, potential risk, and high risk. Today in ECQ, everything is red, right? Everything is a high risk zone, but that's not really the case on the ground. So it will be good with our mapping, with what we're doing right now in consolidating data, to find out what areas have actually low or no community spread of the virus. You were saying, Sir Chito, earlier that why Laguna? Right? So we have, if we have mass testing, we can see and we can show the national government that, hey, there's low COVID spread here. There's really no community spread here. And we only have 2 cases, and one of which is even a false alarm. No? So, but more importantly, the red zones can be locked down and will allow the government to redistribute the limited resources we have. This is checkpoints, the police, aggressive testing, isolation centers, funding, food, and others, and other types of resources that the much needed hard hit areas need, and then the green areas, or the areas that, that have low or no COVID exposure, we can resume some normalcy and start to get the economy going. We hope really that this presentation is, you really find value in this presentation, and you're able to take the protocols that we have and share the data, which is very important. And this is really I really believe so passionately, this is our one chance to be able to manage this virus until a vaccine arrives. Thanks, Jopin.
Thank you, George. All right, Sam, let's look at the barangay bayanihan interaction. So we've been doing a barangay implementation of the ARK protocol. This is because of 2 reasons. One is we'd like to test our protocol and tighten it through these barangay pilots and see where we can make it better. So we've been able to do that by implementing it in Manila, first in the Sampaloc district, then in the Tondo district, and starting this weekend in Antipolo. Now tomorrow and in the next 3 days, Makati, Pasig, and Taguig, correct, George?
We
will
have
be
QC,
starting
Taguig.
also.
Yeah.
QC. So,
yeah.
so those additional LGUs will be starting ARK. So the second reason, besides wanting to test our protocol, is these are LGUs where our businesses are located. So we'd like to be safe. We'd like our workers and our customers to feel safe when they go to these areas. So now what have we learned there? So in the barangay, what's happening is The LGUs are not allowed to buy rapid test kits. The universal healthcare prevents them from using their funds to buy rapid test kits. And yet they need to do screening. So what have they been doing? It's practically begging people. And to the credit of the ARK companies, these LGUs need not beg. George, for instance, donated more than 3,000 kits to Manila. The Federation of Filipino-Chinese Chambers and Industries in the country donated 20,000. Cebuana donated 20,000. The Razon Group donated 20,000. So a lot of companies are donating. I think the SM Group purchased 100,000 that they will be donating to various LGUs around the country. So that's why you see that there are a lot of pledges, actual procurement already of these donations. So in the places in the LGUs where we've implemented this already, we work with the mayor, with the barangay captain, barangay chair, and the kagawads, and the barangay health centers to implement the ARK protocol. So, for instance, no, in Manila, after doing the rapid tests, they're able to segregate those that are quote unquote safe, basically safe, because they're found to be IgG positive. And then they also separate those that need to be quarantined. So Manila has Delpan quarantine, and then there's the national isolation centers like World Trade Center and Ninoy Aquino Stadium. So they have the LGU quarantine facilities, and also the IATF, or National Task Force organized isolation. And then those that need to be tested for PCR, Manila has a memorandum of agreement with PGH to send their swabs over there. Now, we did our testing there starting April 24. So April 24 and 25, the first 2 days that we did it there. So I'm looking at my calendar now, no? Those that needed to be isolated and swabbed, they were swabbed, isolated and swabbed. And guess what? It is now May 11. No, anong araw ba ngayon? It's May 13. Unfortunately, we still don't see the picture of the false positives or the confirmed cases because we don't have the swab test results yet. But be that as it may, the people were isolated and kept away from the general population. Now, there were asymptomatic people who were tested there and found to be COVID positive, or at least suspected of COVID positive. George, ilan ba yun? Was it 31 or 15?
For which one? Sampaloc?
Or Sampaloc, yes.
Yeah, Sampaloc was 31.
31,
but then
right.
of the 31, only 4 was IgM, and the rest of the 20 plus were actually asymptomatic negative.
Okay.
Yes.
So I mentioned this because had we not done the rapid test kit, and I mentioned this because this is what Mayor Isko told us. Had we not done the rapid test kit, he would not have known that these people just walking around in the Sampaloc district were suspected or possible carriers of the infection. The same was discovered in Tondo. Now Tondo in the whole country has the biggest density of people, largest density of people per square kilometer. I think their number there is like 288,000 persons per square kilometer. So in the one day that we were doing press con with Mayor Isko, they were able to test about 1,500 people, almost 1,500 people, and found asymptomatic to also be needing isolation and swab testing. So without the pre-diagnostic tool of using the rapid test kit, these people would have just been going around in the barangay, possibly spreading the infection. So what we are replicating this collaboration of ARK together with donors like the Chinese Chamber, the companies like Angkas and Cebuana and all of that, in different LGUs, where the test protocol that we give them comes also with complete forms that they need to fill in, like the patient data form that they need to keep for every person that they test, as well as the daily report that they need to fill in so that we can pass this on in a very organized, efficient, systematic way to DOH and contribute to the data warehousing and data analytics of DOH. So next slide, please. Let's show you some pictures of that experience. This is the Sampaloc district. As you can see, everything is a makeshift. This is not a hospital. This is not a clinic. This is a public school. And in this public school, on day 1, they were able to test almost 400. On day 2, another 400. So that in 2 days, they were able to finish 854. You see that the people in green, obviously those are they're wearing PPEs. So we make sure that the test protocol all prescribes this, that those conducting the test will be wearing PPEs, and those undergoing the test will follow social distancing and sanitary measures. Next slide, please. There are additional safety measures. Like here you see this plexiglass that keeps a barrier between the testers and the testees. And there's also proper disposal of the materials that are used in the testing. Next slide, please. Okay, so this is the report that I mentioned earlier. So 15 asymptomatic IgG, as George mentioned. That means they are asymptomatic, meaning they don't have any visible symptoms that they are sick or have fever or that kind. And at the same time, they were found to have been that they have the antibody IgG. So they probably did not know that they had COVID and have recovered. And then the IgM, okay, symptomatic
4.
negative.
Yeah.
It's 4, ayun, in the first line, asymptomatic IgM. So there were 4. Those were the ones who were handed off to a PCR laboratory for swab testing. Okay, so the report, the daily report is as simple as this. Next slide, please. I think we have more pictures. Sa Tondo naman ito, no? Okay, now this is the Tondo testing. This obviously is bigger. As you can see, we used a multipurpose hall, and there were something like 4 areas where the testing was done. That's why, you know, a huge number was accomplished at the end of the day. Next slide, please. Okay, so still more. It's very organized, no? Even if it's makeshift, it's very clear to the people where they will go. And where they will go, it's well, you know, it's sort of an assembly line, something that you totally understand, so that we avoid chaos. And there is enough information, even if the person is sitting down, for them to know where next to go, and for them to read up some more on what next to do. Next slide, please. Okay, so this is the report for Tondo. A total of 1,451 tests were done in one day on May 3rd. Happily, asymptomatic negative were majority, which is at 1,342, but asymptomatic IgM were found to be 62. So that's a huge number, considering that these people are just going around, walking around in the district, acting as if nothing is that they're not carriers. Well, we do not know if they are carriers. We're still waiting for the results of the PCR test. Okay, now this for Antipolo Rizal, we started this over the weekend, May 8th on Friday. So we just finished a press conference with Mayor Inares, and we were lucky here. Well, both for Manila and for Antipolo, we're lucky because the LGU is very cooperative, and they're also eager to protect their people. So see here how organized they are. And we also are learning a lot from the barangay and the city health officers, because they are teaching us ways of organizing this thing that we can pass on to the ARK companies. So again, there's that barrier to protect the testers from the test subjects. Okay, next slide, please. So there's the result. Found only one to be asymptomatic IgM. And so, you know, Antipolo already graduated from ECQ to GCQ. And I think just like you, they started early. The mayor and the city health people made sure that as soon as they heard about this looming pandemic, it wasn't even identified as a pandemic yet. They already put out measures to protect their people. So, and it's very evident in the numbers. Okay, next slide, please. So, all right. So let me show you at least an idea of who is behind the ARK protocol. So leading the team is Dr. Mingita Padilla. And the author of the ARK protocol, test protocol, is our Dr. Mingita Padilla and Dr. Ron Jean Solante.
Joby, is she here? Is Dr. Mingita here?
No,
right now?
unfortunately, she is right now training the barangay health people of Makati because they're going to roll out tomorrow. So, I mean, our medical team, just like we are our volunteers, and they spend a lot of time doing these briefings. By the way, no, when you guys are ready to do these medical briefings, we will share with you the medical briefings and training schedules that we have, so that maybe we can your own people can attend those sessions. So we organize even those so that you are assured that the way you're following the ARK protocol and the testing protocol will be that you are comfortable with it. So Dr. Mingita is from UP. She's a clinical associate professor. Dr. Ron Jean Solante is the head of infectious disease in San Lazaro Hospital. People have heard of Dr. Esperanza Cabral and Dr. Manuel Dairit because they were former health secretaries. And it was Dr. Dairit who shepherded the Philippines out of the SARS and MERS-CoV epidemic at the time when he was health secretary. And Dr. June Belisario is the dean of UP Manila. So they lead the medical panel that's guiding the entire ARK movement to follow very strict and conservative protocols. Now, let's get down to what is really important. I mean, this is a simplified chart that Dr. Mingita uses so that we will have an idea when to use PCR and when to use rapid test kits. Sam, can you put that chart, please? Ayun, sa taas, sa taas.
Up.
Up.
Pa.
Sige pa.
The chart.
Some more.
2020.
Some more.
There, 29.
Yan. Okay, good. So this chart tells you when the antibodies build up in your system. So when you have the virus, that's indicated by the presence of IgM, antibody IgM. And when you have the antibody that indicates recovery, that's when the IgG develops. So in this graph, you will see the number of days when it would be optimal for you to take the PCR test. So that's up to 9 days, from onset of symptoms. And then after that, if you say still want to use PCR on day 28, do you think you'll still see the virus? Maybe, maybe not. But if you use the rapid PCR, rapid testing test kits, you would most likely you would still see the IgM if you are using a really good test kit. But most importantly, you would see the antibody IgG, which will tell you that you've recovered. Or if there is no presence of IgG, it means you didn't even have the virus. So this is something that I think everybody who wants to plan for their company when to do testing for their people, and when they're interviewing their employees, this chart can be used as guide as to what the proper test can be done. Okay,
Can I
so
add something, Jopin?
sure, go ahead.
Yeah. So, Sir Chito, to your what you were saying, right? It's this basically um, this basically shows you that it's not just a simple negative or positive, right? This is why you need a physician
Mhm.
to be able to analyze and interpret the results. Now, even the IgG or antibody rapid testing for IgG, this is actually being used by the hospitals for now to deem a patient recovered. So for recovering patients of COVID, they actually test them with antibody rapid test to see if the IgG comes up before they send them out of the hospital. So this is becoming a practice right now in many of the private hospitals, and it's also part of the DOH guidelines. But again, you have to be able to, a layman cannot do this. It has to be a doctor
Okay.
to be present to be able to analyze this with symptoms, clinical diagnosis, and other factors around and not just specific to the testing alone.
Right. Okay. Thank you, George. Sam, can we show the table, the IgG, IgM table? So again, we'll skip all of the charts that the slides that Dr. Mingita is showing. But in a simplified way, this basically, this chart now in front of you summarizes a lot of what is in the ARK protocol. But again, this is very simple, no? Simplified. It's a simplistic table, just like George's three-colored map earlier. Again, this will be just as a guide, but we will need a medical doctor to interpret the situation per patient. Okay, so for instance, you're testing a worker or a person who is asymptomatic. So the 1, 2, 3, 4, the first four fields or rows are for asymptomatic. Kasi po dun sa at the last at the fifth somebody who has symptoms, regardless if IgG or IgM is found, the recommendation is isolate and swab for RT-PCR. Or if no access to RT-PCR, just isolate for 14 days and then test again after 14 days. So let's go to the first
Rapid
example.
test.
For instance. Apo,
Yeah.
this is rapid test. So at the bottom,
Okay.
that's the one you do rapid test and then confirm with RT-PCR. Or if you don't have access to RT-PCR, just leave it be. Isolate them lang. So rapid test, no? Kunyari, you conduct rapid test on somebody who has no symptoms, nothing. And you find that the IgG is positive and the IgM is negative. The recommendation is, yes, that person can return to work. Why? Because the IgG or the antibody that shows that that person has recovered from COVID is present.
Okay.
Okay?
Hindi na nakakahawa yan, ha?
Hindi
Yes.
na nakakahawa. Now,
Okay.
ito po ang something to be cautious about COVID. COVID is such a new virus. We don't know yet, especially with no vaccine, up to when this immunity will be. Unlike mumps or measles or rubella, once you get your vaccine, forever and ever, immune ka na. But for
Ito po.
here, you're considered to have some kind of immunity, but you still have to watch out kasi we don't know yet how long that immunity will last. But you can go back to work. Ibig sabihin, hindi ka na nakakahawa for
Okay.
now. Next, you're found IgG positive. And then you're also found IgM positive, meaning merong trace of infection in your body. So our recommendation is don't go back to work yet.
Quarantine.
Yes. Or stay at home rather than quarantine. Stay at home and then test again after 14 days. Now, if your IgM becomes negative after that test, then you could be recommended to work already because then you'll have the characteristic of the first row. So, next naman po, IgG negative, meaning you did not have the virus. It doesn't seem like you had the virus or you had recovered, and you're IgM positive. So we're thinking here, the medical panel is saying here, you probably have the infection. So you need confirmatory test using an RT-PCR test. Now, yun na nga, isolate for 14 days and then repeat the PCR test after 14 days or repeat the antibody testing after 21 days. Diba? Now, if you look at the DOH guidelines, DOH guideline for memorandum number 180, because you don't have any symptoms, you're not severely ill or critically ill, you are not eligible for RT-PCR, quarantine na lang. You go to one of these quarantine facilities of government to be very safe. And then last, IgG negative, IgM negative, can you go back to work? Yes, the recommendation is yes, unless, of course, with your role, you get to be exposed to people with possible COVID infection, then you need to be isolated for 14 days. Okay, so again, this is a simplified guide for us, but the correlation between the patient vital signs, whatever the doctor sees when that patient is in front of him, and the results of the test need to be interpreted by the doctor. Ngayon, there's a challenge naman po here, no? Especially for smaller or disparate branches of companies using this. So a doctor cannot always be present or made available when you do these tests. So we know that telehealth is something that the country is also already using and has approved. Electronic prescriptions are already approved. So the recommendation of our medical panel is maybe set up a video presence of your doctor so that these tests and the patients can be seen, especially if they are suspected of COVID infection. Okay, so next slide, please. Maybe, no.
It's the
Can we
same.
go and show the Soler testing sample?
So if I may, Jolten, no,
Yes, go ahead.
sir, so basically, even with this testing, no, this is not a free pass to not mind COVID, because like what Sir Joey is saying, that the next day you could take public transportation and that person that you tested that was IgM negative might be infected, right, or incubating the virus already. So you really don't know in between. So even with these testing, even with this isolation and safeguards for mass screening, you still need to make sure that you have the social distancing protocols in place. DOH will be releasing the back to work guidelines, and the hygiene protocols is very important. Communal eating, social distancing, wearing of masks every day to all of the employees, and etc., washing of hands. So all of those things need to be in place, and you still need to kind of treat as though people have the COVID virus to be able to manage and really mitigate the potential spread, no? Because you really don't know in between those times that you test from one time to the next time that you're going to be testing.
Thank you, George. So anyway, so that's as much as we can say, not being medical people, no. But we'd also like to show you these photos of a private sector testing center. Now, the Razon Group is composed of many companies, as you can imagine. The ICTI is only one of them, ATI, and then they have many partners. So they started testing on April 27. Since then, they've tested more than 6,000. I think practically 8,000 of their own employees in the different companies under the Razon group of companies and their partners. So what Razon Group did was to set up a testing center that will benefit not only them, but also their partners. And they made the test plan in such a way that it's also consistent with the research specialist that we invited to guide our companies to do a census in the beginning, meaning all those who have been deemed needed for work, needed to go back to work, were tested. And then after that, those who were tested IgG negative, or for were tested again after 2 weeks or 21 days. No, in Razon's case, sorry, it's just 40 days. So they're practically doing 2 tests a month. At least that's their plan. So in for different companies, depending on the roles of the companies, you also have to make a plan. Oh, sorry, depending on the roles of the people in the company, you also have to make a plan. You also have to make priority lists, categories as to who would be tested first and who will be tested more subsequently, as George was mentioning. So let's show them very quickly what the Soler Testing Center looks like. So if you see here, no, again, it's crude. This is not a clinic. They did not need to get a license to operate for this. But everything that they're doing and the entire setup was guided by a protocol. Dr. Mingita Padilla was also a consultant for this, along with their own company doctors. They also followed strict sanitary and health measures as dictated by their own doctors. So step 1 is registration. So again, very organized, no? See how they are distancing their people very well. Next slide, please. Step 2 is filling out forms. Now, this is manual form. For ARK, we provide you with a manual or a paper data form, a form that you can customize according to your company or location. But George is also working with our partners, Microsoft and Thinking Machines, and Philinvest to do a digital version of this patient data form. Step 3 is testing, the actual testing already. Here, tingnan po ninyo, there's no plexiglass, unlike the ones in the barangay, no. But you're assured that the people are safe because they're properly garbed in PPEs, and the entire setup was designed by medical professionals. Next slide, please. Okay, step 4. It takes about 10 minutes for the results to be to reflect on a rapid test kit. During that time, a video or a TV, a screen can be showing sanitation guidelines or the policy of the company for COVID, or anything, all the information that the employee needs or the test subject would need to keep protecting himself and the company against COVID. In Antipolo, again, something that we learned from there. So this step 4 is like they made it easy, and what you call this does not need human intervention, and yet the information is complete, so that the person is not bored while waiting, is learning while waiting, and is encouraged to be engaged in protecting the company or the barangay while waiting. And then step 5 is health teaching. This is basically counseling. This is where there is some kind of intervention, human intervention, that the Soler Testing Center has put up. And they also do counseling, one-on-one counseling, especially for those that are found to be IgG negative or IgM positive, because then there would be a next step to the rapid test kit, to taking the rapid test kit. So here's a short video of how that testing center looks like. Okay, so that's it in a nutshell. We can open the floor now to questions. Okay, so.
Thank you, Jopin.
All right.
Thank you very much. I think it was presented this time with a little bit more clarity. George, thank you also. Okay, are there any questions from the floor right now? Please raise your hand. There's a digital hand.
Ana Marie Molano is raising her hand.
Yeah.
Yes.
Hi, Chopin. Thank you very much. I was invited by Rona actually because we are the Laguna Techno Park Association Inc. and we're working with Rona. So thank you, Rona, and thank you for Project ARK. This is really very helpful. Actually, I'm interested in the rapid test kits because I know that a lot of our locators are actually looking into having a mass test of all of their employees, but they do not have the resources right now. So, right now, I would just like to ask, just confirming the cost. Is it really 450 for the test kit alone, right? Or
The
average?
lowest price in our list
Mm,
is 450. If you look
okay.
at the FDA list, there's something like
Okay, sure.
36 test kits there already.
Yes, right.
This 450 used to be sold at 800. In fact, when George, bought these test kits to donate to Manila, he paid
Mhm.
800 pesos each. Kasi po at the time, I mean,
Okay.
it was the only thing available. But with Project
Sure.
ARK, we've driven it down to 450. Yes.
Okay. Yeah. But how do we do the will you be helping, will Project Art be helping in how they will do the mass testing and everything? So we'll just arrange with the locators.
Okay, great. I was waiting for this question because I have a suggestion.
Yeah, yeah.
It's perfect po
Right.
kasi because you have a lot of tenants under your in each of
Right.
your
Yes,
areas in each of your
sure.
locations.
Mm-hmm.
They're
And
called
many
locators, by the way. Jopin, they're called
Yes, yes.
locators. The tenants are
Opo,
called locators.
yes. The
Mm.
Yeah.
locators, basically those are just like
So,
in the malls, they have tenants. We've spoken with the
yes.
malls po, no? But the setup is basically the same.
Okay.
Many of these locators or tenants problems
Mhm.
is that they don't have their in-house medical people, in-house
Right.
nurse, in-house med tech.
Mm-hmm.
But if you can join forces, make that resource available as a resource available for everybody in your ecozone, then it makes it and then just charge them for it. Then it makes it convenient for everybody, and then you can even set out rules and mechanics that are fit for your respective ecozones.
Okay.
Yeah.
We are now talking to Philippine Nurses Association,
Okay.
some what you call this, some universities that we are partners with that have graduates of medical technology, nursing,
Mm-hmm.
and medicine, so that
Yes.
we can hopefully recommend this to you that you can hire maybe on a daily or weekly basis so that they can help you with these needs. Kasi po, another option that we were thinking about is there have been clinics and HMOs that have
Mm-hmm.
approached us saying that they offer these services. We just found their prices a little on the high side. I mean, we've worked hard to ensure that the cost of the testing is driven down.
Mm-hmm.
So, and then they will charge you an arm and a leg for the service. Sabi namin, parang hindi yata in sync yun dun sa objectives
Yes.
natin. So,
Mm-hmm.
hopefully within the next few days, we will give you news as to what is available. And in your respective locations po, if you have access to, I think you have access anyway to the universities that are near you. Uh,
Yes. Mm-hmm.
then maybe you can talk to the deans of their allied medical and nursing colleges, so they
Mm-hmm.
can recommend for internship, for clerkship, yun pong mga underboard tapos na, and
Mm-hmm.
then we can organize a training session with our medical team
Okay.
so that after they read the ARC protocol, we
Mm-hmm.
can Dr. Mingita, Dr. Ronji, and Dr. Cabral can brief them on how to do this properly, down to setting up the testing center, down to administering the test, and also
Mm-hmm.
coaching them on how to properly interpret the results.
The results. Okay.
Apo.
Because
We
that's the
also
main
have a
problem of
teaching
the
video.
locators.
Oo, even before even you as lay people, you can also watch the teaching video that Dr.
Yeah,
Mingita created.
sure. We
Uh,
can also organize one so that if our locators would have their own medical team
yes,
watching. My only
yes,
concern is, of course, we have less medical, of course, for one company, depending on the dollar requirement, they only have one nurse or one medical staff. So I was looking at the photographs that you sent. So I thought maybe you did arrange for those who were doing the testings.
Ano po
Or
yung
you
mga
could
yan
have-
LGU, barangay po. George, do you
okay.
recall,
LGU.
what is the human complement per testing center? Did you see that? I mean,
Depende
what's
po
the good? What's a good
Depende
number?
Depende po, but one tandem can do, I think, about 12 an hour.
Okay.
12 tests an hour. One tandem.
Well,
Dalawa po.
dalawang tao yan, George. No?
One tandem po. But nandun po lahat yun sa medical briefing. We will tell you kung ano po yung ratio per medtech or per nurse to the number of testes. That will all be part of the medical briefing, sir.
Okay, who would you recommend to attend the medical briefing, George? Obviously, dapat ito medyo qualified to be able to execute the test. Am I right?
Opo, yung nurse, yung
Yes.
medtech, tsaka yung doktor.
Yep.
Medtech nurse. All right. So,
Pati po yung
okay.
yung mga attendants. Like in our case, George, di ba may mga kagawad na sumali sa mga barangay medical briefing?
Tama po yan. So the decision makers po, HR, should definitely be part of that meeting. And then definitely yung mga kasama po dun mismo sa magi-implement. That's gonna be very important. Kung sino man po sila.
Okay. I have a question now. Testing the employees within the Ecozone is one part. The other part, as mentioned earlier, is the LGU surrounding. No? Kasi hindi naman pwedeng dito lang sa loob ng Ecozone mag-test yan. But to be able to ensure that there is continuity of absence of infection or minimizing it, dapat surrounding LGUs. I was thinking as this was going on kanina, maybe it can be initially at least executed in such a way that the ones being tested within the Ecozone can spread that test modality to his immediate home. You follow? Para although hindi LGU wide. Okay, if I work in a house that my mother, my father, my yaya, etc. At least to ensure or to minimize again the rate of infection, siguro yung immediate first year. Kasi I'm thinking in terms of Ecozones. So employee ABC from ABC company, he's okay, but he should be able to apply the same principle to his immediate residence as a start. Right? And then later on na yung in fact ang LGU dapat parallel yan eh. So, and the LGUs have to be talked to about that. Now the question is, and this is a follow-up to Anna Marie's question. We will, I think, require or request interface with a little bit more detail so that you will understand the nature of our operations. It's pretty much the same, no? Of course, with varying degrees of numbers, etc. It's important that you help us map out the logistics part of it. Who to hire, how many can be accommodated in one day, etc., etc.
Yes.
So aside from the medical part of it.
No, that's a fair question and a fair suggestion. What we do with the LGUs is the first thing we do is after talking to the mayor, give us your focal point so we can plan this out. And then from planning that out, you will be able to identify. It's parallel lang po yan eh. Kung kagawad ang pinag-uusapan sa barangay, in your case, it will be the people enforcing it, diba? It will be the HR people. It will be so if you need to hire a medical technologist or a nurse, so you will not know that until we brief your team properly as to what is needed. Yes. So can be done po, and we're doing it actually for the barangays. And it's also the reason why we schedule every so often medical briefing for the ARK companies, so they have a better appreciation of this situation.
Okay, good.
Yes, Gil de Guzman is raising his hand.
Hello, good evening, everyone. I'm Gil from Western Digital. I'm in the Techno Park, and thank you for inviting us here. I have two questions. So I just like to confirm my understanding. So you mentioned about the 4 hospitals where Project ARK is donating PCR equipments to. Can you talk more about that? It sounds like we're creating a parallel system to what government has as to increase the capability within the Project ARK system to do the necessary second test in case we have somebody positive in the rapid test. So are the 4 hospitals enough, or what's the plan to increase that capacity also in the Calabar zone? And if I may, if I have a second question.
Sure, sure.
I know
go
we're
ahead.
not doctors here, but can you tell us more about, we're hearing so much about false positive and false negative. If you're aware of that, can you share more about that? Because when we talked about this in the company, this has been coming up, and we don't have very concrete answer on that.
Okay.
Thank
All
you.
right. The first question is.
May I suggest,
Sure.
jump in before you answer? There will be a lot
Yes.
more of these technical questions. Hil, pasensya na, I have to apologize. I'm sure there are a lot of questions. There will be, correct me if I'm mistaken, Jopin, there will be a medical briefing, no, wherein these types of questions will be properly answered. So maybe if you can just abbreviate the answer. Sorry.
Yes, yes, yes.
Go ahead.
No,
go ahead.
no, definitely. And I will not be, neither George and I will be confident about answering that question anyway. We will be mouthing what we've heard Dr. Mingit and Dr. Cabral has shared before. To the first question about the PCR donations that we made, we look at it rather than a parallel effort of government. It's an augmentation to what government needs. Kasi po, government needs 30,000, at least in their estimate, they need 30,000 daily capacity for the country in PCR testing. And government is not capable of setting that up. They cannot afford it, and they do not have the wherewithal to do it themselves. So they've been asking for help from NGOs, i.e. Red Cross, and private companies to donate. So we are adding. We are helping the government fulfill their obligation to us as a country to raise that 30,000 capacity. Now, kami naman po, when we chose those hospitals, we also consulted Secretary Galvez of the National Task Force. Sabi namin, where can we help you augment capacity? And that's why meron po kami as far away as Zamboanga and a small laboratory in Cebu, because he suggested that those laboratories need help. Yun naman pong sa NCR, we insisted that there be one in near the Calabar zone area. That's why we chose Perpetual, and it's a private hospital, hindi po yan government. Why? Because we know that companies like you who are in Laguna, in Batangas, and Cavite will need capacity. So it's to augment po. Now, we did not stipulate in the MOA that these hospitals will prioritize us workforce. But because we are augmenting government capacity or national capacity, it means that the line for asymptomatic people like us, workers for that matter, will be shorter. Plus, we are making this information available to ARK companies. So when you go to those hospitals, even if it's not written that you're priority, they will give you the time of day. Okay, so it's to help. Now, that's the only money we were able to raise, enough for 6. But after the press con, we are receiving more information from companies wanting to donate more. Now, kayo po, kunyari, I mean, as a group, you'd like to set up one for yourselves. If, say, Ecozones near Laguna area, or near that area want to put up one, maybe we can help you with that. I mean, if you go through our foundation, maybe you'll find a cheaper or a more affordable donation than if you put it up yourselves commercially. Okay, to the second question naman po about the false positives. It really starts po with the brand or the kind of rapid test kit that you buy. I mentioned earlier that in April, when we were starting the ARK, we did not have a lot of choice of rapid test kits because we were competing with the rest of the world. But now we are getting more information, and in fact, we got an American brand rapid test kit that yields specificity of 99.6%. Meaning, and this I am just mouthing Dr. Mingita here because I don't know this for a fact, meaning that the false positives will only be, or false negatives will only be 0.4%. So the margin of error is smaller. So, but you can confirm this with more reading. We will give you the reading material about all of these products, all of these rapid tests that are available right now in the ARK list. And when we do our medical briefing, you can also ask this yourselves of Dr. Mingita and Dr. Cabral.
If I may add, Sir, Ma'am Jopin, no?
Yes.
So not to touch on the medical side, but I think Project ARC has really done considerable work in validating, getting information, and having a lot of literature around these test kits. As what Jopin has said, right now, I think about FDA has 34 test kits that they've approved, right? And not all test kits are created equal. So of course, you have to be vigilant also to read up and figure out what test kit is best for you. But we do have a lot of information that we've gone through already that we can share so that you can be also well informed in terms of, you know, the test kits that will give you the best accuracy for your purpose. But that being said, not all test kits, there's no such thing as a perfect test. So even with the RT-PCR, they miss 1/3, and it's not the molecular PCR test that misses it; it's the swabbing. So the swabbing is prone to human error as well. So we're not downing one or the other. That's why we're using both, and you know, not just using the test itself in a vacuum, but also with physicians that will have clinical diagnosis around it, which is why it's important for it to be analyzed alongside other factors and not just not just the specific result of the test itself. Yeah.
All right. Thank you. Okay. So just to do a time check, it's now 6:41 in the evening. I know, I'm sure people are busy, but if you'd like to ask one or two more questions, we can go ahead. Go on.
Maybe last two questions, folks. Last two questions.
Yes, sir. Mr. Almazan.
Yeah, Jopin. Hi, George. Evening. Good evening, all. I'm just reminded about sometime, I think, first week of May, there were around 13 OFWs who went home to Cebu. Initially, they tested negative in Manila.
Yes.
Under a rapid test, and then when they came home to Cebu, 13 of them tested positive. So what happened there?
Okay. We immediately investigated that situation po. Firstly is, remember that chart we showed you about the right time to test for antibodies? So we don't know when they were tested and when they were interviewed, if they were properly interviewed as to the onset of their symptoms. So that's one factor. It's properly we're not sure about the timing of the test. If at the time that they were tested, it would have been more appropriate to test them on PCR or on rapid test kit. That's number one. Number two, George said that not all rapid test kits or not all tests are created equal. We immediately tried to find out what test kit was used on these people. And sad to say that what was used on them is the same brand that United Kingdom sued China for $20 million because these are defective test kits. Or should we say, maybe not defective, but inadequate test kits. So the false positives of the test kits used on them were high, or false negatives were high. I mean, the inaccuracy was terribly, terribly high. So when they were tested in Cebu for the RT-PCR, they found a different result. So that's another thing po, no? That's why in ARK, we don't put any brand or any supplier there that we have not verified. We help the ARK companies by sifting through the 36 brands already out there and telling you which ones have the higher specificity and higher sensitivity. And then you choose from there based on what you can afford and what's available.
Have you had similar incidents with your test kits?
Wala pa po.
Okay, that's good.
So, rule of thumb po, no, for the ARK protocol, because we are testing for antibodies, we are only using test kits that can determine separately the IgG and the IgM. The ones used on these 13 OFWs who went to Cebu do not determine those two things separately.
Still, even if they use your test kits, the ones with Project ARK, even if they test negative, it doesn't follow that they're not COVID positive, right?
Yes.
Doesn't
Kaya po may
follow.
protocol eh. We'll be definitely sharing with you the ARK protocol so you yourselves can read it. Laymanized naman po yung ARK protocol eh. Even I, with no medical background, understand it. The way Dr. Mingita calls it is they've crafted it as if it's a cookbook. So madali, very instructional po.
Yeah, kaya that's where the danger is. So even if you are negative, it doesn't follow that you are not COVID positive. Diba? Yun talaga yung danger niya. So we're just trying
well,
to...
in fact po pag IgM, yeah. Oh, you're right. That's why there is a recommendation to isolate you.
And better yet, PCR later on.
Yes.
Talaga may PCR test pa rin. Okay.
Opo. But then they were not eligible for PCR. Why? Because they were asymptomatic.
Yeah.
So they
That's
would
the
not have
problem.
been allowed
That's
in
really
Metro
the
Manila.
problem, yes.
Yes, that's correct. Okay.
Thank you.
Okay, thanks. Gil, you have another question?
Yeah, thank you. If there are others who don't have questions, maybe my question is, what do you suggest for a company like ours? And I suppose I represent several other companies like ours, manufacturing, factory. If we're gonna do this every 14 days and we're 9,500, sounds like a real big investment. I calculated 2 times, that's 900. So easily 8.5 million pesos per month. And then as we said, no, this is going to go on until there's a vaccine in place. So has there been like some study or something on how long we're gonna do this? I know you mentioned about prioritization plan, but kasi factory yan eh, assembly setup, they're all together. Any thoughts on that?
Right. So you're saying that all of your employees need to be in the factory, cannot go shifting, no? And nobody
They're doing
can
shifting
say,
as it is, yes.
no, sorry. I should say nobody can work from home because they need to work in the factory.
Oh, yeah.
How big is your workforce, Gil? How big is your workforce?
We're 9,500 easily. 6,500 of those are in the factories doing shifting daily.
So 6,500 at any given time. Any given time per shift. Okay, that's quite a number.
And
no, sorry. 3,000 per shift.
Okay,
3,000 per shift. Yes. And are you providing some kind of transportation or accommodation for any of these people?
Combination, yes.
Combination.
I think, sorry, for me, Gil, no,
Go ahead, George.
I have the same problem. My fleet is 30,000, and I've been racking my brain and really having, really pencil pushing, and none of it makes sense at this point in time. But really, versus the amount of money that you lose on a daily basis, you really need to make some hard decisions on, how do you want to kind of ease in to restart the economy a little bit, the economy of your business a little bit more. Shifting will help decrease it. Again, there's a way for you to be able to mitigate this, but there's no hard and fast rule whether it's every 2 weeks or every month. But you need to really determine what is comfort level on your part to get this going. Now, it will really help if you have social distancing in place. That may also bring down the efficiency of your factories as well because of the space. But yes, it will have to be really are part of our cost of doing business. Now, other companies may choose to do much less, but it really is to the level of your comfort on this issue. I don't know what to tell you other than that hard truth. And I face this truth every single day talking to my management because we have 30,000 people that's out on the road on a daily basis.
Right. Hill, if I may, no, George is correct. And even when we consulted our research specialist to help design the sampling, he said the same thing. But I also heard Dr. Mingita say, and you can confirm this next time we get together with her. I also heard her say that it, of course, you cannot control where your people go home. Just like Chito was saying, you don't know if the people in his home will be exposed to
Yeah.
COVID. But maybe exert a little more effort into doing research that way, so that those who've tested IgG positive can be categorized differently, so that you will test them less frequently. But that will really need a little bit more intrusive survey within your organization as to the lifestyle of these people, the home life of these people.
Yeah.
I mean, things like that. But I mean, I will stop there, but I know that those are some of the things that were prescribed in a medical briefing, depending on the situation of the company. You're not the first factory we've heard who said that we have the garment factories, they have 50,000 people. The plan is to do a census of all 50,000, and then they want to sit down with us to plan for the rest of the year, because they're planning their expenses for the rest of the year to cover testing. So maybe when we set up that meeting with all of the factories, we'll invite the factories in your areas.
So definitely random sampling will not work, right?
If you look at the DOH guidelines, they actually recommend random sampling. No, they recommend random sampling. I think there will be companies who will follow the DOH guidelines to test 10 per building. You know, like in a building where there are 5,000 workers, they will do a random test of 10 people. There will be some people who would do that, yes. But as you said, I mean, your people are practically elbow to elbow, and you don't know if they are exposed to COVID at other times besides the factory setting. So it will really need some more planning. So I don't want to recommend really anything very specific, because I'm not a medical doctor, but we can set another briefing with the doctors so that you can be clarified some more.
May I inject something? Pardon the pun.
Okay.
He'll, in a company like yours, I would understand and imagine how the numbers always stack up to the bottom lines, no? But in this situation, which is unparalleled, it's never happened before, all right, where we're dealing with things like this. When you talk of the millions of dollars that you will spend in having to do these tests, I think you should put in parallel what happens if you don't do the tests, all right? If you create a pandemic within your organization, your own pandemic, that will mean that your operations will stop, and that's going to be much worse than having to cough up the millions that you have to be prepared. Yan lang ano ko, no? In other words, it's definitely going to cost, but if it's going to be a perfunctory application of the tests only to later on find out that may nakalusot pala, then it becomes a bigger problem. You understand what I'm saying?
Yeah, of course.
Yeah. So yun lang ano ko. So anyway,
definitely it's a big business decision. Yeah,
I know it's tough. I know, but and that, like I said, this is unprecedented. It's never happened before in the business world. So you have to take some drastic measures as well. Anyway, thank you for the questions, Hill and Basil and Anna Marie. I think we've already exceeded the time. Thank you very much, Jopin. Unless there are any more urgent questions, I will thank Jopin, George, and of course, please convey our thanks to your crew. We look forward to having will we have a second session with the medical briefing?
Yes, we can set that up. For now, I suggest that you send focal persons. You advise Claire and Sam about your focal person, so we can give them the initial information. Once the group has appreciated and digested the ARK protocol and the materials that we've given you, we can set that medical briefing.
Okay, we'll do that. thank you again. So are we adjourning the meeting already, Jopin?
I
That's
think
it,
so.
no? Yeah. Thank you very much again. I forgot to mention the guy who put this thing, help us put this thing together. He was coordinating with your guys. Is our executive director, Arnold Canaria. No, I was telling, because we were getting very very bothered already by the schedule movements. In fact, this one, sabi ko, walang mag-attend. Thankfully, we had a much better
I know.
turnout.
Thank you, really. Every day we have 3, 4, 5 briefings.
I can
And this
imagine.
afternoon, we apologize for changing the schedule, but Mayor Inares requested the schedule this afternoon. And
No
happy
problem.
naman po.
No.
Thank you very much.
Thank you. Okay. Thank you very much. Again, guys who attended, maraming salamat. We'll keep in touch. Thank you for coming.